Go.
Arrive on scene. Scene is safe. I'm going to cross some skis uphill so we don't get hit. I've got my standard precautions if I need them. I'm well protected from the patient at this point. I see one patient. She appears responsive. She's sitting up holding her knee. And I believe I have the resources I need for this call right now. Patrol dispatch, this is Matt. I'm on scene. And I'm going to go ahead and approach the patient. I don't see any obvious major bleeding that would require a tourniquet. She's sitting up and is responsive, so she doesn't need CPR. And we're going to consider the possibility that she could need C-spine precautions based on the mechanism. And I'm going to go ahead and assess her airway and breathing by talking to her. Hi, my name's Matt. I'm one of the ski patrollers.
Hi.
What's your name?
Laura.
And what happened, Laura?
I fell, twisted my knee. Hurts pretty bad.
So she's got an open airway. She's talking, speaking in full sentences, so her breathing appears to be adequate. Okay, is it okay if we help you and check you out?
Yes, please.
Okay. I'm going to go ahead and check a radial pulse. Got a good, strong, regular radial pulse. And capillary refill is less than 2 seconds, so I'm satisfied with perfusion. And I don't see any other sources of bleeding, so I'm not worried about that right now. All right, just a couple questions for you. Tell me your name again.
Laura.
And Laura, where are we right now?
We're on Thomas at the skiway.
Okay. And what day of the week is it today?
It's a Friday.
Okay. And tell me again exactly what happened.
I was just skiing and caught an edge and twisted my knee, and now it really hurts.
Okay. Patient's moving all her extremities spontaneously. I'm not worried about disability. And as we come to any injuries, we'll expose those. And as soon as we get a toboggan here, we'll protect her from the environment, get her in a sleeping bag. So I'm done with my primary assessment. And so, Laura, tell me again what happened.
I was skiing and my knee twisted. I felt a pop.
Okay. And it's that right knee.
Yeah.
Does anything else hurt?
It's really just the knee.
Go ahead and take a deep breath for me. Does that all feel okay?
Yes.
And did you hit your head?
No.
You remember everything that happened?
Yes.
Who are you here with today?
Seeing some friends.
Okay. How'd you get here?
I drove.
Okay. Is somebody else going to be able to drive if you need to go to the hospital?
Yes.
Alrighty. We'll get a hold of them once we get down. Okay, so I'm going to move on to my secondary assessment. Just first, real quick, a couple questions for you. Are you allergic to anything?
No.
Taking any medicines?
No.
Any medical problems at all?
No.
What was the last thing you had to eat or drink?
I had a sandwich for lunch.
And what were you doing before you fell?
I was skiing down Thomas and just my knee sort of twisted, caught an edge.
Okay. Had you been feeling okay earlier in the day up until this happened?
Yeah, totally fine.
Alrighty. So pain in the knee started just immediately when you fell or before you fell?
Yes.
Have you done anything that's made it feel better or worse?
I think bent like this feels a little better.
Can you describe what the sensation feels like?
It's aching. I've injured this knee before, so it feels a lot like that.
And is the discomfort all right there in your knee, or does it go anywhere else?
It's pretty much in the knee.
On a scale from 0 to 10, 10 being the worst, how bad is the pain right now?
It feels sort of like a 7.
Like a 7?
Yeah.
And does it change over time, or does it pretty much always stay the same?
It's been sort of the same since I fell.
Tell me again, how old are you?
21.
So I'm going to go ahead and call our dispatch, let them know what's going on. Patrol dispatch, this is Matt. And actually, cut. And how old are you?
21.
So what I'd like to do is, where the pain is pretty bad for you, I'd like to go ahead and call an ambulance for you. Possibly they can give you some pain medicine on your way to the hospital. Is that okay?
That'd be great.
I think you should definitely go to the emergency room and get that looked at where you're in a lot of pain.
Great.
Okay. Patrol dispatch, this is Matt. I'm on scene with a 21-year-old female patient with a knee injury. She's complaining of 7 out of 10 pain, so I'd like you to go ahead and call an ambulance for us. All right, so the next thing I'd like to do is to just do a quick physical exam to make sure you don't have any other injuries or anything else that's bothering you. Is that okay?
Yeah.
All right, so I'm going to go ahead and first get a set of vital signs. I've got a pulse of 96 and a respiratory rate of 20. All right. So you said you didn't hit your head, you had a helmet on, that's good. Head all feels okay?
It feels fine.
I'm gonna leave the helmet right on if that's comfortable. Any pain in your neck or back at all?
Nope.
Coming down the back of your neck all feels good?
Feels fine.
And all the way down your back?
Feels normal.
Just let me know if anything feels unusual. All feels good. Okay. Take another deep breath for me. Feels okay? Good. Any pain in your belly at all?
Nope.
4 quadrants. Hips, pelvis, all feel okay?
Yeah.
I'm gonna do the good leg first. This all feels okay up and through here. And this knee, had you ever hurt this knee?
No, just the actual.
So it's the bad knee too. All feels good. Can you wiggle your toes in your boot?
Yes.
All right. And feel me touching you right there. Any numbness or tingling?
No.
And just checking. Feels nice and warm. Toes feel warm? All right. And on the bad leg, I'm just gonna.
Sorry.
And on the bad leg, I'm just gonna start up here. Let me know when I get to where we're talking about. This all feels okay up and through here. Feels okay there. Right in here.
Yeah, in the knee that really hurts.
More on the inside or more on the outside?
I feel it more on the inside.
Kneecap feels okay?
Yeah.
On the
It all,
outside.
it all just sort of hurts a lot.
This bone down through here
That feels okay.
and on the outside.
That feels okay.
Okay. And it feels nice and warm. Toes feel warm on this side?
Yeah, they're okay.
Okay. Wiggle them for me. Numbness or tingling?
No.
You feel me touching you there?
Yeah. It just hurts to move.
Okay. And just real quick, checking your arms, shoulders, all feel okay. Down through here, all feels good. Pulse again. Go ahead and give me a squeeze. Good. Numbness, tingling in the hands?
No.
You warm enough?
Yeah.
And good pulse. All right. Just going to protect you from the environment while we get a splint on that knee. How long you been skiing here?
This is really only my first time at the skiway.
All right. I'm going to leave that knee out where I can get a good look at it. So what we're going to do is we're going to go ahead and put a splint on that for you. So I checked. I made sure she's got good CSMs so you don't have any problems with the nerves or arteries or veins in your foot. So this is what we call a quick splint. Basically what we're going to do is I'm going to have you reach forward and stabilize above your knee. I'm going to stabilize the lower part of your leg. We're going to lift that up. I'm going to slide the splint underneath. Does that sound okay? Kind of in an awkward spot here. Am I still in frame? Okay. Go ahead and lift. On the count of 3, we're just going to lift up a couple inches. 1, 2, 3.
Ow, 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 ow. That hurts me bad.
I want to get that right up in there. Do you think we can straighten it out a little bit, or is it better with it bent?
I can try.
Does that feel okay?
It feels okay. It doesn't hurt.
Keep holding that for me. I'm going to try to do this with as little motion as possible, but there is going to be some discomfort. Once I get these straps on, you can go ahead and slide your hands out. Great, good job. Were your friends going to wait for you at the bottom, or should we be looking for them on the chair left?
I think they're at the bottom. We were almost done skiing.
Strap. Be real gentle with this strap because that's the area of injury. Just let me know if there's too much pressure and I'll back it off, okay? Feel okay?
That feels okay.
And one more. All right. Does that feel okay?
Yeah.
Relatively comfortable?
Yeah.
Where are you on that scale from 0 to 10 as far as pain?
It's stayed the same, but it hasn't gotten worse.
Still about
Seven.
a 6, 7. Wiggle your toes for me again. Still feel your toes? Numbness, tingling? Feel me touching you there? Still warm or about the same?
Yeah.
All right, so what we'd like to do is I'm going to go ahead and we'll get you in the toboggan, and we're trying to transport you down to the base lodge and have the ambulance take you to the hospital and hopefully get you some pain medicine.
Great, thank you.
Okay, and I'm done.